So let's discuss greater trochanteric pain syndrome. So what it is, it's a culmination of several different types of injuries that kind of all build up and overlap and kind of help one another make this an even more painful condition. So what it is it's typically a combination of bursitis. It's also a combination of IT band syndrome, as well as you're going to see weakness or some kind of tendinopathy or inflammation of the muscles of the hip adductors, abductors, or which are your glute muscles, kind of the muscles on the posterior aspect of the hip. So this condition is typically brought on by several biomechanical defects or just poor motor movement patterns in the human body. You're typically going to get kind of that imbalance in the pelvis and in the hips and in the muscles, so you're sometimes going to create a little extra stress in this area. So typically people with this type of condition, this overlying kind of a culmination of injuries, also will have a higher prevalence of having low back as well as hip conditions as well, because the biomechanical shifts in the body, and if you're trying to protect maybe an injured hip, it's going to kind of throw off the rest of the biomechanics of that pelvis and that low back. So I think the research is kind of in the ballpark of about 35% of people that have this type of hip condition also has concurrent low back and hips or pelvis dysfunctional conditions as well. So typically when a patient shows up into the office, something that we will see, it's very common, is just pain that's right on the outside of that hip bone. So people will kind of just pinpoint that pain as to that location. In that area, you're also going to feel a lot of muscle tension, a lot of stress. If we're kind of feeling the muscles and moving things around, we're going to see those trigger points as well. We're going to feel that tension, things like that. Now, this condition is most of the time brought on, if people do a lot of sitting, if they sit a lot, one position, or maybe they're standing a lot for prolonged periods of time. This is also very common in females or males that cross their legs over just one way. So if they just cross it over most of the time, it's going to stress a lot of that tissue on that lateral aspect of that hip. So that's something that we typically see kind of presenting into our office when this condition does arise. So how we're going to fix this condition in the office is typically we work on kind of fixing those faulty biomechanic and movement patterns. So we got to make sure that we kind of balance out the muscle tissue side to side. We got to get in there and do the myofascial release. We got to do the trigger point release on all those tight muscles. We got to kind of retrain the body to kind of balance itself out and kind of work together. So that way we're not getting that extra stress or that extra pressure on those structures of the body. Now, typically conservative care for this condition, you get about 90% improvement. 90% success rate. Conservative care is a phenomenal option for this injury because, a lot of it is just musculoskeletal based. Now, typically if a trial of care does fail, we tend to refer out. An MRI is a really good option for this condition. It's going to look at the tissue, it's going to look at the muscles and just kind of determine, what is really the driving factor for this. So once we've kind of worked through and broken down all the muscle tension and the stiffness and kind of worked out all the muscle trigger points, we tend to kind of get you into the gym here. We're going to incorporate strengthening and stretching exercises. We're going to teach you how to strengthen and stabilize the hips, grow some strength into those glute muscles, as well as kind of just teach you how to work them properly. So it does take that stress off, and it also balances out that pelvis. So we do also have to teach the patients proper squatting and proper hinging in the hips. We got to teach them all the proper ways of doing those, because that's going to help limit the pressure on these tissues after you're out of the office, after you're released from care. We got to teach you how to kind of prevent this from coming back. So lastly, the biggest thing for this condition is you got to check the entire mechanical kinetic chain. We got to make sure that everything is moving and grooving like it should be to prevent any excess pressure or stress put on these structures. So, we'll have to check knees, we'll have to check feet, we'll have to check hips and low back. We got to make sure everything's kind of in that area. It's just kind of moving like a well-oiled machine. So that's typically something that we would see kind of around the office and kind of how we would treat this particular condition. So if you or you know someone that might have some form of a hip injury, our office would love to take a look. We'd love to give you kind of our opinion and kind of put you through a test and move you through some exercises. Just kind of rule in and rule out this condition. So feel free to give the office a call at 513-463-3011 and we'd be happy to help. See you soon.